the need of digital diabetes in India. If you consider India as a whole, in India, there are around 76 to 77 million subjects with diabetes. And if you look at the control of diabetes in the country, majority of the patients have a hemoglobin A1C of close to 9%, which means in the majority, maybe up to 90% of the patients, diabetes is not under control. So it's very shocking that despite the availability of almost all the treatments and technologies in diabetes in our country, even among the affordable class, diabetes is not under control. So why is diabetes not under control? If you have 100 patients with diabetes, you probably doesn't require any technology. But when we are speaking about thousands and millions in the country, without technologies, I will say it is impossible for the doctor, impossible for the patient to control diabetes. I would say that in India, the patients, we are quite fortunate in India because most of the technologies which can be used in diabetes for bringing better outcomes in diabetes, they are available in India, number one. Number two, they are available, most of them are available at an affordable cost for the common man. But why the common man is not using it? The simplest answer is the common man is not aware of the technologies for the prevention of diabetes complications. Why it happens in India? In India, most of the technologies in health are used for treatment of diseases. For example, if a diabetes patient develops a heart attack or a kidney disease or a foot ulcer, they will go for an angioplasty, they will go for a stenting, they will go for a laser treatment, they will go for technologies which need to be applied over the foot ulcer, amputation. But they never, probably the patients are never using technologies which need to be used by themselves, which can prevent all these expensive and disabling complications. So almost all the technologies, I would say, the inexpensive and affordable and fairly accurate glucose meters, which is the simplest and the life-saving technology, the mobile health applications. All the mobile health applications, most of them, and many of them which are to be paid in other countries, they are available at a cost which is free for the customer in India. I would request all those people with diabetes in the country to search for themselves for the available, I would say, it is user-friendly and life-saving technology. When I say life-saving, it is in the true sense. It is going to save your life. And then you can have a brief conversation with your doctor. Hey doc, should I be using it? And how should I use it? That's it. And if I am to discuss about the use of telemedicine and these digital gadgets, I would say that telemedicine is there for more than 40 years. But during the COVID times, we have been using telemedicine probably much more than in the earlier times. But the patients can have a face-to-face visit to the hospital, maybe 1, 2, or 3 times a year, once the diabetes is stabilized. But very frequent telemedicine consultations, and that too with the help of remote monitoring, it can be revolutionary. Half a dozen glucose meters which are available in the country, they have a mobile application with them, and these are the examples of connected glucose meters, which can connect either directly or via Bluetooth to the mobile health application, which can auto-generate the patterns and graphs, which can even provide you with the data on the time which is spent within normal range in diabetes, the time or the percentages of time which is below normal, above normal. So these are all robust data, rich data, where the patients are benefited. Because we are discussing about technologies where the patients are benefited. Remember, my dear friends, all these are available at no extra cost to the customer, at no extra cost. And it's so unfortunate, most of the patients are not aware of this. You should be using it. You should be using, and when you use it, the result is you prolong your life. And you prolong your life, at the same time, there is no loss of quality of life. Because most of the time, the diabetes patients, will have a suffering during the last 8 years of their life. So here, along with the prolonged longevity, you have all your vital organs stable and healthy. So enjoy your life, use digital technologies. Yeah, artificial intelligence is being more and more commonly used in diabetes. So in a recent survey among the app developers, more than 70% of them give an opinion that digital technologies are most useful in one branch of medicine, and that is diabetology. So the reason being, if you are using AI in diabetes, artificial technology can be used for prevention of diabetes. It can be used for early detection of diabetes. It can be used for detection of diabetes complications. And it can be even used for precision diabetes in selecting the right drug for the right patient. Instead of simply giving the same medicine for everybody, we can even use artificial intelligence in our electronic medical records, so that even if the patient is not on a regular follow-up, if the patient is using a glucometer, for example, with remote monitoring capabilities, I can make a prediction of whether he'll be developing a complication in the kidney or in the heart or in the nerves. So technology is advanced, amazing. Yeah, the mobile health applications are again another revolution. So a diabetes patient always require, I say, a girlfriend or a boyfriend or a partner. That is absolutely essential. And his or her duty or responsibility will be to remind the patient. So it's time for blood glucose check. It is time for you to exercise. It is time for you to have the lab. It is 3 months and it's time for you to report to your doctor. It is time for you to have a hemoglobin A1C check. Oh, you are on an intermittently scanned continuous glucose monitoring device, and it is time for you to have this again. So the doctor has advised to have this once in 3 months. So it is a reminder, and it should never be bored. Boredom is a problem with the use of some of these apps. And if these apps are AI powered, again, there is no repetition of the messages from the coach. And the coach appears as if the coach is not only a reminder, but a very close partner. And this makes the patient with diabetes very comfortable and safe, especially in those apps where there is a marketplace available, where the drugs can be purchased or the devices or the strips can be purchased. But eventually, I would always say that the gadgets are never a replacement of a doctor or a dietitian or a diabetes nurse. The gadgets are also there to remind that it is time for you to consult your doctor, time for you to consult a dietitian. But for diabetes, you need to take care of medications, you need to take care of diet, you need to take care of exercise, and all these need to be customized for the individual patient requirements. And for this, you require human intelligence along with artificial intelligence. And that is where the apps and robots are superior along with human intelligence and doctors in bringing better outcomes. So when I say better outcomes, it is both short-term and long-term outcomes. We came out with this recommendation based on evidence being generated over the past more than 70 years. Because for around 100 years, conventionally, pulse rate, blood pressure, respiratory rate, temperature, all these have been considered the vital sign. But if you look at the recent evidence, even in the absence of diabetes, when a patient is hospitalized, or when the patient is infected, or when the patient met with an accident and in the hospital or at home, even in the absence of diabetes, if there is minimal increase in the glucose value, if there are glucose excursions, all these studies have shown that even new onset high glucose will increase the number of days in the hospital, will increase the chances of death, will increase the chances of renal replacement therapies like dialysis in the hospital, increases the chances of overall causes of death in the hospital. So glucose is now a vital sign. So we need to test blood glucose in everybody in the country. Because there are millions and millions in your country with diabetes, but they don't know that they have diabetes. And there are millions in our country and they have pre-diabetes and they doesn't know that they have pre-diabetes. And all of them will transform to diabetes in maybe in less than 5 years' time. So testing is absolutely required. And to defeat diabetes is one of the landmark. I would say that it's one of the most significant movements by the RSSDA. And this is going to be part of the history. Absolutely no doubt about it. Remembering the World Heart Day with testing for diabetes. In diabetes, majority of the patients ultimately succumbs to heart disease. They die of a heart disease. And it can be a heart attack, it can be a heart failure, it can be a cardiomyopathy. But the message is, all these are preventable if we can control the glucose, if we can properly manage your blood pressure, and if you can normalize your cholesterol levels along with healthy diet and regular exercise. Join us on this mission and defeat diabetes.